Hello, everyone. As the current Rogers Chair in Studies in Journalism and New Information Technology, I want to welcome you all to today's Distinguished Speaker Series. So welcome to FIMS, welcome to Western, welcome to London, welcome to Canada. The topic is of the utmost importance, and Dr. Grusz's partnership with the World Health Organization and other institutions in Canada, very current and of great national and international impact. I would like to start our event with Western's land acknowledgement to create awareness of Indigenous peoples' presence and connections to these lands. With great respect, we acknowledge that Western University is located on the traditional lands of the Anishinaabe, Haudenosaunee, Lenape, and Chonnotone nations, on lands connected with the London Township and Sombra Treaties of 1796, and the Dish with One Spoon Covenant with the Lumpum Belt. With this, we respect the long-standing relationships that Indigenous nations have to this land, as they are the original caretakers. We acknowledge historical and ongoing injustices that the Indigenous peoples, that is First Nations, Métis, and Inuit, endure in Canada. And we accept responsibility as a public institution to contribute toward revealing and correcting miseducation, as well as renewing respectful relationships with Indigenous communities through our teaching, research, and community service. Next, I would like to provide some information about the format of today's talk. First, Effie Sapuridis, one of our outstanding FIMS graduate students, will introduce Dr. Anatoly Gruz on behalf of the Mediations Programming Committee. Then Dr. Gruz will give a 40-minute lecture followed by Q&A period. We ask that everyone keep their mics and cameras off during the talk. Please also do not use the chat. I will moderate the Q&A period. Please raise your hand. I would really appreciate it. And I will do my best to take questions in order. I also want to stress that, we ask you, because there's so many people and there may be a lot of questions, to keep your questions brief, maybe 1 to 2 minutes. That would be great. There'll be an opportunity, if you want to connect with Anatoly later to further discuss some of these issues. And if you rather ask a question via the chat, we will also moderate the chat and read questions. So that's totally fine. Now that we have the logistics all figured out, welcome again. I would like to now invite Effie to introduce Dr. Anatoly Gruz.
Thank you, Annabelle. It's my honor to introduce our speaker today on behalf of the Mediations Programming Committee. Dr. Anatoly Gruz is a professor at the Ted Rogers School of Information Technology Management, Canada Research Chair in Privacy-Preserving Digital Technologies, and the Director of Research at the Social Media Lab at Ryerson University. He is also a member of the Royal Society of Canada's College of New Scholars, Artists, and Scientists, a co-editor of a multidisciplinary journal on big data and society, and a founding co-chair of the International Conference on Social Media and Society. The broad aim of Dr. Gruz's various research initiatives is to understand how social media data can be used ethically to tackle a wide variety of societal problems, from combating COVID-19 misinformation to helping educators navigate social media for teaching and learning. Anatoly's talk is entitled Studying the COVID-19 Infodemic at Scale. Anatoly, we are very much looking forward to your talk. Take it away, the floor is yours.
Thank you. Thank you, Annabelle, for inviting me to speak to the FIMS Rogers Chair event. And thank you, Effie, for this introduction. Before I start, I just want to say a couple of words about the Social Media Lab. We are a multidisciplinary research center at the Ted Rogers School of Management here in Toronto. And the lab is co-led by myself and my colleague, Philip Mai. The lab actually celebrated 10 years anniversary last year, but because it was the pandemic year, I think we'll have to repeat the celebration in person once it's safe to do so. Some of you know the lab from the International Conference on Social Media and Society that we host. And in fact, I want to use this quick opportunity to invite you to submit your social media related research to the conference. It's going to be hosted virtually next year in July, but the submissions are due in January. So hope to see your submissions. In terms of our own research at the lab, we focus how social media is changing the way people and organizations communicate, share information, and form communities online and offline. We usually have 10 various projects in the lab on to go focusing on applications of social media in business, academia, and health. And today's topic will really touch on two of our research streams, which is health and well-being and the spread of dis and misinformation online. Since the first lockdowns happened, social media has emerged as a lifeline for many people to connect with friends, family members, and co-workers. They also use social media to get news and latest information about the virus and the pandemic. For example, according to Statista, all major social media platforms have seen the rise in the monthly active users since 2019. TikTok, for example, grew by 38% and Facebook by 19%. But it's not just the number of people who are joining websites. They also actively contribute to social media. They engaged with others, community members. They interact with them. This unfortunately comes, not without a cost, because social media has emerged also as a vector to spread misinformation, and specifically COVID-related misinformation. And all of that contributed actually to the phenomena what we know as infodemic. Infodemic is characterized as the abundance of both credible and non-credible information about the pandemic. And in that situation, it makes it difficult for people to essentially figure out whom to trust and what information to believe in. For example, when we conducted survey among Canadian adults last year, 68% actually told us that they encountered misinformation, at least on one of their social media websites, just to highlight the prevalence of the problem. To fight COVID-19 misinformation, public health agencies, news media, and international organizations such as the World Health Organization started debunking claims about the pandemic and the coronavirus. This screenshot shows you a snapshot of the international COVID-19 fact-checking ecosystem, showing where fact-checking organizations reside and what do they fact-check. They look at claims like supposedly drinking methanol, ethanol, or bleach would prevent or cure COVID, which is not true, or would debunk the claims about, allegedly links between 5G mobile networks and the spread of COVID-19. The reason, the COVID-19 misinformation is so dangerous, because, during any kind of pandemics, it's really important for people to get accurate and timely information. And so if we were to allow COVID-19 misinformation to spread unchallenged, it would really undermine the work of public health officials and put the public and frontline workers at risk of contracting or spreading infection. Misinformation about the virus can also contribute to people's fears and essentially even lead to instances of microaggression. We've seen some of those over the past couple of years. In addition to medical and physical danger, misinformation can also cause people to become victims of identity theft or other data breaches. So hopefully by now I convince you why it's important to study the prevalence, the presence, the spread of COVID-19 misinformation. And now let me tell you a little bit about our projects that focus on this topic. I'll cover two topics today, two projects that we're doing in the social media lab. One is about COVID-19 misinformation portal, and the second one will dive deeper into a specific case study where we analyze social media data to understand strategies behind one conspiracy theory in this area. So first, let me tell you about the COVID-19 misinfo portal. This is a rapid response project. We actually launched it February 2020, before the pandemic, before it was officially announced as the pandemic. And the project, the portal, is in part funded by the Canadian Institutes of Health Research, the World Health Organization, with this computing resources supported from Compute Canada. The primary aim of the portal is to put spotlight on COVID-19 misinform and inform the public about its danger. Our motto for this portal is come for the misinformation, stay for the fact. There are multiple components. I'm not going to have time to go through all of them in the portal, but definitely if you have time and interest, check it out. It's just, COVID-19misinfo.org. What I wanted to focus today, one of the primary features of the portal is the dashboard, misinformation dashboards, COVID global and COVID geo. This is where we're actually keeping an eye on debunked COVID-19 and coronavirus related claims. So let's start with the COVID global misinformation dashboard. I'll tell you a little bit about what type of data we collect, and then I'll show you an example of how we can actually derive some insights about the patterns and the types of COVID-19 misinformation claims that are out there. So first, when you arrive to the dashboard, it quickly shows you the number of COVID-19 related claims debunked, reviewed by a fact-checking organization in the world, around the world. And then it highlights, which types and so on. So first, let me go through quickly, show you the backend of the system. We used Google Fact Check Tools API, which allows us to kind of a couple times a day to go in automatically and check, are there any new COVID-19 related claims that mention keywords like coronavirus and COVID. And because slightly more than 50% of claims are actually not in English, but we kind of cater in this dashboard to English-speaking audience, we're using Google's translator API to automatically translate the description of the claims and some of the metadata. So after this step, we then have a group of research assistants in the lab who are trained to do a quick data integrity and quality check. What they also do is then assign for each claim that arrives to our database, they assign it to one of the 11 common types of COVID-19 misinfo. And so this is the 11 types that kind of were developed in an iterative process over the last year and a half. The most common ones we discovered are related to specific country or region, followed by diagnostics, prevention, and cures. Then you have claims that exaggerate virus severity, and this can be either amplifying or diminishing, depending on who is speaking and what context. Then you have number 4, claims about various conspiracy theories, and those that were speculating on the virus origin. And those claims we're seeing a lot at the beginning of the pandemic. Number 5 would be claims around public figures. Early in the pandemic, there were lots of claims about such and such got COVID. Later on, it's changed a little bit. The flavor of these claims changed. Then number 6, claims about businesses and economy. Some of the more popular ones you probably encountered were about Corona beer, that supposedly it's somehow linked to coronavirus. And then we have claims talks about how the virus being transmitted, how you can actually contract it, followed by claims about environment and climate, especially how the pandemic and lockdown orders impacted what's happening around us, followed by claims related to different medical procedures, usually done in hospitals context. And so the last one, the second to the end is the climate and environment, and the last one about fraud related claims. So all of them are essentially fake and misleading claims related to the virus. The reason we like to categorize them in those 11 types of categories, because it actually helps us to know and understand the trends related to each of these types. Because we believe that to address the issue of COVID-19 misinformation, we have to cater to specific misinformation type. Because the way you inform the public about and address false claims related to diagnostics and prevention and cures might be different from how you address the issues related to fraudulent claims. Let's say you have a tweet saying that, hey, download this app and you're going to get latest information about COVID-19 outbreaks around the world. And what happens then, the admin taking over your phone and stealing some information. So clearly, both are problematic, but the way to address them quite different. I'll give you a quick example. If we look at the diagnostics, prevention, and cures claims, and we'll look at the number of claims in this category over time. And this gives us a nice time series chart that you should see right now on your screen. And we immediately can zoom in on 2 spikes, and we'll kind of label here spike A and spike B. even though this is all same category, we can actually look at the spikes generated based on slightly different type of claims. So the first spike was around March, April of 2020, and most of the claims in that spikes really talked about cures and preventative measures that are unproven and quite dangerous. Like the last example here, you can see that supposedly using a hairdryer to breathe in hot air can cure COVID-19 and stop its spread. So those quite dangerous claims. But then if we move forward in the year and look at the second spike, that's around December 2020, and then early in January of this year, that spike actually associated with announcements and approval of COVID-19 vaccines and launch of national vaccination campaigns. So as soon as that happened, you saw claims like the nurse who fainted after receiving the vaccine has died, or the fact that, or supposedly that Pfizer's first COVID-19 vaccine was staged, or COVID-19 vaccine causes irreversible genetic damage. So those are all fake claims about the vaccines. What we can learn though from this example is that there are different dynamics and different factors may trigger these spikes. In the first case, there was a lot of uncertainty at the beginning of the pandemic. As a result, in this vacuum of knowledge, when we did not know enough about the virus, how it spreads, how we can cure it or prevent it, you see a lot of claims related to that started circulating. In the second example, spike B, we actually see that the spike kind of correlates with the news coverage and research developments in that space. If we know when spikes happen, we can then kind of plan ahead and work with public health authorities to run essentially information campaigns to mitigate some of the negative impact that this type of claims may cause to society. Then moving on, the second example, and it's the last one from the portal, I just want to highlight the COVID geo misinformation dashboard and types of insights we can derive from this type of information. It's essentially the same data set, but what we did, we zoom in on the most popular claim type, where a particular claim relates to a specific geographic location. So we use natural language processing library to automatically essentially look at the claims and label those, put aside those that refer to a particular country, city, town, and then we're using Google Map, what you can see on the screen, and to show where exactly what countries are more frequently mentioned or subject or target of COVID-19 claims. So let me show you types of insights we can derive from this type of analytics. What I'm showing here are mostly time series kind of analysis, but of course, you can always think about mixed method approach where you start with the overall picture and certain trends, and then you can zoom in on different outlier events and different spikes in data to derive insights. So what I selected here for this slide, essentially 5 countries that were the subject or target of the most number of COVID-19 claims in 2020. Now let's start with China. So China was the first country to become a target of COVID-19 misinformation. And so you can see there are a lot of claims happen in early 2020, in January, in fact. And I apologize, my PowerPoint crashed, so just give me 1 second to restart it. But what is interesting about China, that what types of claims that circulated around that time in January 2020 around China actually were reused in the context of other countries, like US, like Canada, like Italy. So we know what kind of claims and misleading statements are made about China. We can, again, kind of prepare ourselves and our society a little bit better to what we can anticipate. So my PowerPoint just restarted it. So let me just reshare my screen. So I apologize for that. So the second country that was the most targeted by false misleading claims about COVID was the United States. And so in the US, the pattern is not as kind of obvious as the China. So you can see most of the claims around about the US started when the pandemic was officially announced in March. And there are multiple spikes. April spike, we can see more prominent than mid-June, mid-summer, and then the fall. Many of these spikes associated with the spike of number of cases, COVID cases in the country. But we also can correlate those spikes to what politicians and particularly the US President Trump at the time made, what statements, false and misleading statements made about the COVID, the pandemic, and unproven treatments like hydroxychloroquine. Then the next country here in this chart is actually Brazil. A very similar pattern to look at. There are not as many claims about Brazil as the US, but you can still see a number of spikes happening, especially late springtime and over the summer, and then picks up again in the fall. So here, similarly to the US, it's political polarization in the country, and President Bolsonaro's support for some of the unproven treatment options really spike propagation of many of these false claims. The next case of India, that one a bit more complex. India is a very large country with a lot of cultures, political dynamics happening. And here, as a result, we also see claims kind of mimic and corresponds to different divides in the country, either across religion line, political divide, or economic divides. And I think each of those divides will need to be addressed separately if India wants to combat misinformation in that space. Italy case was a little bit more straightforward. And if you remember, Italy was the first European country that really experienced this pandemic in full March. So you can see a huge spike at the time of false claims about the country. Some of you might have seen pictures and videos of coffins of dead people on the streets, supposedly, in Italy. So those are claims we would classify as exaggerating the virus severity, because the pictures were not real patients or dead people who died because of the COVID, not to, of course, diminish the severity of the situation in the country. But what was interesting and problematic at the same time, that the claims were attacking the government and health system, which is fine to essentially criticize a particular system if they're not addressing or battling the pandemic. But these type of claims, we're doing it through the use of false and misleading claims. So that's the part that I see as problematic here. All right, so now we at the kind of second part of what I wanted to share today, to dive specifically in one of the cases that we analyzed in the social media lab with Philip Mai, my co-author on this paper, where we analyzed the spread of #FilmYourHospital campaign on Twitter. But before I do that, can somebody tell me why? So we look at the fact check claims by professional or news media organizations around the world, and you can see it's useful to detect some of these claims and see the patterns over time. But what are the main limitations of studying infodemic at scale by just only looking at the fact check claims? So if anybody, and I think you can use as a chat room just to throw some ideas. What are the main limitations you think? And Firoza, you have a hand raised. Maybe we can, maybe you can speak.
Yeah, I think one of the challenges of depending on fact check is that depends on context, depends on location. Not all communities have access to digital tools to actually share or to be the misinformation to be disseminated the way, that's in the urban cities or the global north. The data is more prevalent and easy to collect, but probably not all the parts of the world.
Thank you. This is exactly one of the main issues with fact checking, that we do see those kind of information deserts where there are not enough resources, like some African countries where we don't see a lot of fact checking happening. And as a result, essentially misinformation cannot be effectively addressed through that. I'm looking through the chat room. So Ahmed, you're saying that not every single item is fact checked. Fair enough, very good. Not all fact checkers are fact checked as well. That's true. So you kind of highlight into additional problems, essentially, that fact checking organizations, they usually fact check based on reports of social media users flagging certain things. And what we observed over the couple last year and a half, that a lot of viral claims usually fact checked first, but more nuanced claims or claims that were circulating in the smaller communities or private channels are often missed. So thank you for making that point. And as well, that the fact-checking, anybody can start fact-checking and creating a website. It's very easy, but it doesn't necessarily mean that they have expertise to do so. So thank you, Ahmed, for that point. And Annabelle, you saying that in Guatemala, people also don't trust them. So that's kind of broader issue of trust towards public health authorities, governments, as well as the fact-checking organizations. It's true that to be effective in this space, if you are deciding to fact-check something, you need to build a kind of relationship with the community you're serving to. The problem that we're observing right now, so the project we did with the World Health Organization, where we kind of documented the fact-checking ecosystem around the world. And so we noticed some of the organizations that started at the beginning of the pandemic, they actually disappeared. Because they were volunteer-based. So there are no structural kind of support to keep those organizations going. What happens that next time around when pandemic strikes, another pandemic, hopefully not in the near future, but it probably will happen, those organizations will not have an opportunity of that time being around and building the trust with the community members they serve. And so Hazel, you're making a point about that the message itself evolves over time. And there's a possibility that fact-check message breeds other versions of satire, or I can add also the fact-checking may become the false misleading claim as well. You're absolutely right. We've seen how some of the claims that were fact-checked later on, the fact-checkers themselves had to update that. The fact-checking to based on new scientific knowledge. So a lot of problems with fact-checking. So it is a useful kind of tool for us when we're studying infodemic at scale. That's the topic of today's kind of presentation, but we have to keep in mind all of those limitations. And this actually brings us to the second part of the presentation to show you how we actually look at the observed data that coming from social media, independent of fact-checking efforts. We're trying to understand the spread and strategies that some of the bad actors might be using when they're trying to spread misinformation on social media. So let me tell you a little bit more about this the case study. It started actually in late March of 2020, when social media users started using the hashtag Film Your Hospital to encourage others to visit their local hospitals, to take pictures and videos as a proof that supposedly COVID-19 pandemic was an elaborate hoax. And the premise for this conspiracy theory essentially rests on the assumption that if hospitals, hospital parking lots and waiting rooms are empty, then the pandemic must not be real, or at least not as severe as the health authority told us about. So of course, there's a simple explanation why some of the hospitals were empty, because as part of the pandemic planning, many hospitals ban visitors or postpone or cancel some elective surgeries. So they freed up essentially medical staff and resources. And furthermore, there are some references to show us that there are fewer people who are getting sick in general, fewer people having heart attacks and fewer visits to emergency departments. So there are multiple reasons why some of the hospitals might have not been as full. It cannot be really used as a justification that pandemic was hoax. But some people were still trying to push that conspiracy theory. And in fact, it was fueled by CBS News' erroneous use of footage when they showed a crowded hospital, real hospital, but it was in Italy. The problem that they showed that video when they talked about the situation happening in New York City hospitals. And so all of those pieces of information was used to start convincing people why the fact that the local hospital might be empty is evidence that pandemic is fake. We studied this manifestation of this campaign on Twitter specifically. And so the first tweet that launched this campaign on Twitter was this one from anonymous account, which is no longer active. Hashtag Film Your Hospital. Can this become a thing? ? So that happened March 28th. And so what we were interested, how a single tweet started a large Twitter campaign. And you can see this tweet by itself only got 33 retweets. And the anonymous user only had, 2,000 followers. So that's might not be enough to launch a viral campaign. We use Netlytic, social media analytics program we've been developing to collect public tweets with the hashtag over the period of this campaign. Altogether, we collected about 100,000 posts contributed by about 40,000 Twitter users. You can see at this timeline of number of posts over time, there's a first spike, essentially the campaign went viral 3 days after, around March 31st, and then it kind of fizzled out by March the 9th. And that's our kind of data collection time period. We use social network analysis to understand how this campaign propagated and actors behind this campaign. In case you don't use social media analysis in your work, let me just briefly introduce a couple key concepts, because I'm going to show you network visualizations later in this presentation. So I want for you to be comfortable with what you see on the screen. So usually when we say we analyze something using social network analysis, it means we take a data set and represent it as a graph, where each node, in this case, will represent Twitter accounts. So let's say we have 3 Twitter users, John, Anne, and Mary. So you'll have 3 dots in your network visualizations. And then you connect them based on observed interactions. And so in this case, we studied information flow or misinformation flowing, and we were interested in all kinds of signals that indicate people either paying attention or sharing content online. So we connect people based on observed retweets, replies, or mentions. Direction of the connection is important and shows us where information or attention goes from whom to whom. We can also assign a strength to each of these connections or ties based on the number of observed interactions. So that's all you need to know just in terms of basics of building networks based on a conversational data set or interactional data set. To demonstrate that, let's look at this sample tweet from Trump's account when it was still active back in all good 2019, where Trump tweeted, "It was a great honor to host Canadian Prime Minister at Justin Trudeau at White House today," and 2 emojis. So to represent this tweet as a network, as a graph, we can look at poster who posted the message, in this case, real Donald Trump, and then connect that user to 2 other users mentioned in the post. So in this case, at Justin Trudeau and at White House. So a single tweet can be represented as a graph using this network representation with 3 accounts and 2 lines going from one account, from real Donald Trump account to Justin Trudeau, Canadian Prime Minister, and at White House. So it's simple as that. In reality, of course, you're going to have a data set with hundreds, thousands, or millions of tweets. So you will repeat, or the systems designed to do that, like Netlytic, will repeat the steps for each of the tweets in the data set. And what will happen when we apply this algorithm to the data set we've collected for this study, this is the type of network visualization that emerged. It helps us to quickly identify groupings, nodes that tend to cluster with each other. And here the color kind of helps us to highlight those clustering homophily, what we call effect. But it also quickly shows us whether or not everybody kind of connected to each other or other outliers. And then, it helps us to generate additional questions to investigate. To understand how this campaign manifested on Twitter, we examined the formation of this network over time. And so this particular slide shows interactions posted during the first 3 days of the campaign. Notably, you can see that one of the most influential users in this particular time period who triggered the viral spread of the misinformation was an account for Diane Lorraine. She's a former Republican congressional candidate, and she ran against Nancy Pelosi in California. Unlike the anonymous poster who started the campaign, I showed you the tweet earlier, and really attracted only 33 retweets, Ms. Lorraine's account added legitimacy to this campaign, and because she directly asked her 150,000 followers to, and I'm quoting, "get hashtag Film Hospital trending and post pics of your hospital here." So during subsequent 2 days, so we're kind of moving through time, So now we're at on March 31st. So subsequent 2 days, the network kind of really exploded. It was mostly retweets of tweets posted by prominent conservative commentators and political activists. An example is here, Candice Owens' Twitter account. She actually has 2 million followers, and so she joined the conversation as well. While influential conservative politicians and activists, just a couple examples I showed you earlier, were behind some of the most shared content during the early stages of this campaign, the question for us was, who are actually behind all these retweets? 83%, in fact, of all the data here are retweets. And so who were the accounts that were behind this second stage, past the initiation stage of this campaign? So to answer this question, we examined the most active accounts in this network, and to demonstrate that I have this word cloud visualization of most frequently words in the bio description, user profile description of 100 or more users. And so what you can see, the keywords that people use to self-describe their online identity includes hashtag MAGA, which, as you know, stands for Make America Great Again, CAG, Keep America Great Again, Trump, pro-Trump, Trump 2020, and some other QAnon-related keywords and hashtags. So that just gives you kind of a flavor of who were the most active users who were retweeting content of prominent politicians. And so while the majority of them appear to be Trump supporters, 7 days after the initial hashtag Fill Me a Hospital tweet, so on April the 3rd, we see that the hashtag went international. So you can see new clusters form. And so right now what I did, I switched the color of the nodes to represent the language in which the posts were shared. So in this case, we have, so English, I put it purple color, Arabic, a bit of small cluster here in orange, Japanese, pink. And so a larger international cluster was in Portuguese. And when we examined some of these accounts, they were from Brazil. And so similarly to the US, a lot of Brazilian accounts were run by popular conservative commentators and activists who often self-describe themselves as supporters of the President Bolsonaro. What is not surprising, this US-style politics has been on the rise in Brazilian society over the past few years, and it really culminated with the election of Bolsonaro for right candidate in 2018. But it is interesting how it spreads, how the campaign that started in the US then was picked up by some of the users in Brazil. What we're not tracking here, though, that in some countries, this hashtag actually was adopted and translated in their local language. So the international reach of this campaign probably is far beyond this English mostly network. Well, so far what I showed you is essentially a description of the data set, description of some of the main actors behind the campaign. But when we study misinformation campaigns at scale, what we're also interested in, whether or not the campaign was amplified by automated accounts, or was it amplified by some accounts that coordinated their work? And essentially, can we observe some inauthentic behavior, what Twitter calls? One way to do it, well, as researchers, all we have is the access to public Twitter API. And through that access, we don't have any, for obvious reason, private information of users like phone numbers, IP addresses, but Twitter has all of that. And so one way to check whether there was some suspicious behavior happening on suspicious accounts in your data set is actually to go back to Twitter and recollect your data set day, week, couple weeks, months later. So in our case, we waited for 10 days and we recollected, check for each of the 40,000 unique accounts. Are they still there? Are they on Twitter? Why? Because when you do that, Twitter API tells you whether the account was suspended, temporarily restricted, maybe it was deleted by the user, maybe account became protected. So those are very important piece of information from research perspective. And why? Because if we look at the rules, Twitter rules on their website, there are 4 main reasons why an account can be suspended. And that includes if they artificially amplify or suppress information, if they interfered in elections. Number 3, shared manipulated media, which may cause harm. And number 4, promoted violence against or harassed individuals or groups. So those are important signals, and that's what we did. And so let me show you the results. So altogether, 10 days after we finished data collection, we found that about 5% of all the tweets and retweets were either deleted by users or disappeared because they were flagged by the platforms. So, but again, we were interested about instances when not just user will change their mind because they posted something regrettable, but we were interested in platform taking action on the user because of those 4 rules I mentioned earlier. So, so when we look at the status, why the account disappeared, were they suspended, temporarily restricted, about 1,000 of them turn out to be suspended or restricted. And here I highlighted them in red color. And so you can see, even though the red color dots and interactions that were propagated by them more or less appear throughout the network, different parts of the network, they mostly concentrated in the area that was most active during the second part of the campaign. Remember I showed you those pro-Trump accounts that jump into the action to support and propagate prevalent conservative activists and politicians. So that's the area that lit up. So it doesn't necessarily mean they are automated, but it does suggest that there's something happening there. There's some kind of manipulation or attempt to amplify, which can be done by legitimate accounts as well. But to kind of double check whether that manipulation, potential manipulation, happened with automated accounts in play, we also turn to a popular batometer API. And there are, those are who do batometer, bot detection in general, the automated accounts that exist on Twitter, they'll tell you that none of the approaches 100% foolproof. And so again, we're looking for general trends and general cues to explore further. And so in this case, we'll look at this batometer API, and the API produces different scores. And specifically, we'll look at something called complete automation probability score. And that's what you see the chart visualizes. There are 2 versions of this score. One is done with consideration of the content accounts posts. And so that's the blue color bar charts, bars here in this chart, that it only works for English language accounts. And the other one can be applied for accounts that post in other languages, because it does not consider the content of tweets that they are posted. So what is useful to consider here is the distribution of all of these accounts. We did not do it for all 50,000 accounts because we really wanted to look at most active accounts. Again, who were behind this propagation effect, viral effect behind the campaign. And so to do that, we look at 3% of our data set, which posted at least 10 or more tweets. So because this group of accounts really stood out, their behavior was somewhat different from the rest of the network. And so when we check the 3%ers, majority of them, based on this distribution, you can see their scores were skewed towards 0. And when it's so low, it suggests that it's unlikely they were automated. So it's probably real people, just very passionate or misguided, who tried to share that hashtag to contribute to this conspiracy theory. And so depending on where you set the threshold, and previous literature suggested maybe 0.25 value could be a threshold. So if we set that, only 40 accounts really would require further investigation that might suggest they were potentially automated. So to summarize, our analysis, what I presented today, suggests that most of the active and influential accounts behind the hashtag #FilmYourHospital campaign on Twitter are unlikely to be automated, but we did find signs of ad hoc coordination among conservative internet personalities and far-right groups attempting to take this conspiracy theory and weaponize it against their political opponents. Importantly, we did also find that while much of the content came from users with limited reach, the oxygens that fueled and expanded this conspiracy theory, especially in the early days, came from just a handful of prominent conservative politicians and far-right political activists. So these power users use the hashtag to build awareness about the campaign and to encourage their followers, as you saw, to feel what was happening in their local hospitals. So this is an example of a campaign going from online to offline action. So after the initial boost by these few prominent accounts, the campaign was mostly sustained by pro-Trump supporters and followed by secondary wave of propagation outside the US, especially in Brazil, as you saw. So what happens in the US doesn't necessarily stays in the US. So what lessons can we learn? So the case demonstrates that while the spread of misinformation can be potentially mitigated by fact-checking and directing people to credible sources of information, false and misleading claims that are driven by politics really much harder to root out. So as long as there are opportunistic political activists and they find it useful to exploit conspiracy theories during the COVID-19 pandemic, we will continue seeing this type of spread of damaging ideas and false claims. The other point I wanted to make here that aside of politics, the virality by itself is the design of social media platforms. So it's not a bug, it's a feature. And we have to recognize that. And there are some interesting experiments that some platforms trying to introduce friction to slow down the spread of all kinds of information. And for example, you might have heard, WhatsApp, it's been limiting how many people you can forward your message to. So this is an example of slowing down the information and the frictions. So I would love to see more platforms experimenting with this type of features. But what's more important, of course, is to do formal evaluation of these features to know whether they are effective in the combating the spread of misinformation or not. Because there are a number of interventions been thrown and tried by platforms over the past year and a half, but we don't have a good picture just yet. Are they effective? We all have seen, some tweets were labeled as false. We all have seen every time we tweet something with the word COVID or coronavirus or vaccine, immediately we have a link to, Health Canada, for example. If you're in Canada, a link to their website with more information about COVID-19 and the vaccines. But what we don't know whether these strategies are effective or not. YouTube, for example, we're looking at another project, looking at how recommender systems might be amplifying some of this content because of their popularity. Well, YouTube said, okay, we're going to stop promoting and disallow posting content, anti-vaccination content. Well, just this week, we've been looking at the fresh data, and we still see a lot of anti-vaccination content on YouTube. So there are lots of, essentially to say, interventions thrown out there. We want to have a bit of a systematic approach to actually understand which ones works and how well, so that we are definitely ready for the next pandemic and subsequent infodemic. So thank you, everyone. I hope we have some time for questions and your comments. Oh, and by the way, before we open up, I just want to say, direct people, if you are interested in this topic and would like to learn more about other case studies researchers in the space did, I want to direct you to the issue that I co-edited with my colleagues recently for Big Data and Society. It's called Studying the COVID-19 Infodemic at Scale. There's a set of related papers in this space, and we're actually running a guest speaker series around some of the papers published in this issue. If you're interested, check out our list of speakers at socialmedialab.ca. So I hope to see you at that speaker series soon. Okay, thank you.
Okay, I think that's back to me. So I would like to thank Anatoly for this very insightful talk. I come away with new understandings exactly of how this infodemic is happening, and also kind of like stimulated to do new research, try out again on analytics. So I'm kind of excited about that. And I must say I did learn a lot of new stuff here, because I didn't know about that additional analysis of, what are those accounts that are either being deleted or disappearing and what their role is. So, I kind of had a sense that that's what's going on, but having to be able to empirically kind of test that is really pretty cool. So thank you again, Anatoly. I know you have a very busy schedule, so we really appreciate you taking the time out. I also want to acknowledge, a team here at FIMS who's done an outstanding work helping me put together the talk. So, just want to mention a few people, although many people have helped. So Becky Blue, Alice Yin, Matt Ward, and Charlotte McLennan. So thank you for doing all this work with Zoom, social media, and so on. I also want to thank Mediations and the student group, and in particular, Effie Saporidis for being co-host of the event. And I want to thank you all for joining. And just last kind of pitch. So tomorrow, Anatoly is doing a workshop where we will be looking at a new tool, Communalytics. So I'm actually really excited. I haven't used Communalytics myself yet. So if anybody wants to take a part of that, do send me an email. There's still a few spots. So that's aquan@uwo.ca. And I'm happy to add you to the workshop tomorrow. That's a hands-on workshop with actual data where we will be doing some analysis and visualizations. So with that, I want to open up the floor. We have a few more minutes for questions. So I'm really looking forward, what are some, I have a lot, but I'm going to let other people as well ask some of the questions. So, okay, some people are leaving. Well, nice to see you, Hazel. I understand if you gotta go, but you can either put up your hand if you want to ask a question or add it to the chat, whichever you feel most comfortable with.